Florence Seibert, a relatively unknown biochemist, was born in Easton, Pennsylvania on October 6, 1897. She was the middle child of three, and her parents were George Seibert and Barbara Seibert. She contracted polio at the age of 3, leaving her with the slightest disability that affected the way she walked. She graduated from high school as valedictorian and earned a scholarship to go to college. She attended Goucher College in Townsend, Maryland, where she earned her bachelor's degree while studying chemistry and zoology. She later worked as a chemist for 2 years, since many men were deployed to war at the time. Later, she earned a PhD in biochem in 1923 at Yale University, as she focused on pyrogenic portions from vaccinations. While her studies, she was supervised by Dr. Lafayette Mendel, who encouraged her to find the importance of vitamin A in a diet. They also worked together to figure out how to eliminate bacterial contamination that occurred after being injected with a vaccine or injection. An article found online by Lemelson, MIT, states Seibert discovered were most often caused by bacterial contamination of the distilled water used to make the solutions. She was able to eliminate this contamination using a special apparatus and procedure she created for this purpose. Florence invented a water distiller to be able to prevent these types of contaminations. This also improved intravenous drug administration and blood transfusion. During the time Florence was alive, women were not given many of the same opportunities as men. Women were usually seen to stay at home and service their husbands. Instead, she wanted to be a biochemist. Florence was lucky enough to be able to study as a chemist while most men went to war. There she was able to progress in her studies and build her credibility. Although being a woman was not her only problem, she was still considered disabled. This was due to the polio she contracted when she was 3 years old. This caused her to walk abnormally. The complications grew, which also led to her death in the future. Florence's contribution is actually very important today. She was the first person to be able to isolate the tuberculin, an active antigen in tuberculosis disease. This discovery led to the first reliable test for tuberculosis known as the tuberculin skin test, which is still used to this day. Tuberculosis is known for attacking the lungs, spine, brain, and kidney, which may be very fatal if not treated. Florence also contributed to making intravenous drug administration safer. She invented a water distiller to prevent the contamination of bacteria in injections, making it safe to conduct IV medications. She did this after realizing that many patients would become ill. This project has improved my knowledge of sexism towards women. Women have been belittled by men many times, especially while Florence was alive, because women were usually stay-at-home wives who would cook and clean for their husbands, who went to work. And for the women who did work, worked in factories, and were paid minimum wage to pretty much nothing. Florence exceeded in her education and was lucky enough to be able to work as a chemist, because there were men who were sent to war. If she had not been given that opportunity, then we would lack clean IV drug administration and many more people would have suffered tuberculosis. Florence was also disabled, but that did not affect her and her career. It's proved many useful points that could still be applied today. Being a woman, disabled, or both, you can still achieve anything you want. Florence Seibert may be relatively unknown today, but because of all her hard work, we can now help someone identify if they have tuberculosis and properly inject someone with a drug while having it be clean and safe.